the latest diet craze to sweep the nation called intermittent fasting.
Intermittent fasting.
Intermittent fasting.
Fasting.
Intermittent fasting can lead to great health benefits.
Plays a large part in preventing diabetes.
Fantastic for helping us lose weight.
Improving obesity, improving insulin resistance. People slept better, they felt more energetic throughout the day. Cellular repair in your body, break down toxins.
Do a longer fast, get more healing, get more autophagy.
You hear all of these incredible claims about fasting, but no one told me it could ruin my health.
Is intermittent fasting harmful? Hi, I'm Dr. Eric Westman, and welcome to my channel where I review and debunk nutritional misinformation online. In this video, we're going to hear from an influencer and nutritionist about her own use of intermittent fasting, what it did to her, and how she adjusts or accommodates that in her life, and then also how she teaches other people what to do. It's going to be a great video to talk about the context of what we're discussing. Is it right for you? Is it right for her? And there may be big differences in our body metabolism and our lifestyle that make what we do different, or what we do can have different effects. So hang on and wait till the end and I'll tell you my final thoughts.
I started intermittent fasting back in 2016. I wasn't even fully aware of all of the health benefits at that point. I was just doing it because I wanted to get a little extra sleep and make my mornings less rushed. So I started skipping breakfast, no problem, and accidentally intermittent fasting.
So always consider the source. This is an influencer. I've watched her videos for a while now, even spoke to her about her blood tests and reassured about a lot of those blood tests. Lily is a nutritionist and an influencer. In general, I really like the information that she gives. It's based on her own experience. And she got into this largely for health and fitness, not for diabetes reversal, not for obesity or other metabolic symptoms or problems, which is an important point we'll get to again.
Now at first, I felt great. I had more energy, I felt more focused, and I was saving time not cooking. And then a couple years into it, I started hearing more about all of the health benefits of intermittent fasting. Improved insulin, weight loss, longevity, mental clarity, and I thought, perfect, I'm already doing it. But then over time, things started shifting. I started losing more muscle mass, losing more hair. I was feeling cold all of the time. I couldn't sleep. My menstrual cycle became irregular. What I thought was a healthy habit was slowly wrecking my health. My name's Lily. I'm a certified nutrition health coach, and I have so many clients who they're fasting without realizing it's the very thing that's holding them back from reaching their goals.
So what is intermittent fasting? How do you define it? This is one of the problems. You can say you're intermittent fasting and you can be eating junk foods once a day. That's into the definition of intermittent fasting. You can intermittent fast, which is time-delimited eating during a certain number of hours and not eating during a certain number of hours. And you can be eating a high-carb diet, and it's called intermittent fasting. You can be intermittent fasting eating a low-carb diet, which is what I recommend, but we'll get to that again in a minute. But so the definition of intermittent fasting varies. And then who are we talking about? So what I don't hear much is, Lily, what kind of exercise and what lifestyle are you trying to maintain? We get a snippet of that in there, but so compare, is your lifestyle similar to Lily's? You may or may not need to have the same amount of food. We'll get to that she figured out. And it's important to always consider the context of the influencer you're hearing from. And most of the people who come to me, if you're my patient, you're not as young and you're not as in the gym as much. And I think that's a big important difference in context in what your body can do and handle. And let's keep going with her experience. The wait is over. My Carnivore course is now available for purchase. If you've tried low carb or keto, but still struggle with fatigue, inflammation, digestive issues, or autoimmune symptoms, this course could be the reset your body needs. Inside, I'll show you exactly why plant foods might be triggering your symptoms, how Carnivore works as the ultimate elimination diet, and why this approach is so effective for healing and restoring your health. This isn't just a guide, it's a full program built to help you take control of your health, one meal at a time. Click the link below to get started today.
Now, I've found there are two main reasons why people fast. One is for weight loss, and the other is just for overall health and longevity. So we're going to cover both. Let's start with weight loss. Most people think that intermittent fasting helps with weight loss, especially when they see someone online say that it helped them lose weight. But the truth is, fasting doesn't cause weight loss. Eating less food causes weight loss, and it just so happens that when you have a smaller window to eat, most people naturally eat less food. If I were to say you can eat as much as you want from 12 p.m. to 4 p.m. in that smaller window, or you can eat as much as you want from 7 a.m. to 10 p.m., you're likely going to eat more food when you have more time to do it.
It's a great way to lose weight. After all, if you don't eat, you're going to lose weight.
And yeah, I have to agree with this. There's a little nuance about how much you can eat. You can eat a little more on a low carb diet, or maybe a lot more depending on your metabolism. But the point's well taken that if you're eating OMAD, one meal a day, it's very difficult to get in as many calories as you would if you ate 3 meals a day.
So yes, most people, when they eat either junk food or healthier food, when they eat in a condensed window, they tend to eat less food and therefore see more weight loss intermittent fasting.
They looked at these volunteers for 4 weeks. They did find that they had marked changes in weight, in body composition, a decrease in their abdominal and truncal fat content.
Why do you think that is?
Because they actually had 37% reduced calorie intake, even though they were in those 12 hours indulging in things like pizza and hamburgers.
But the reality is, if I were intermittent fasting and I ate this pound of beef at 12 p.m. and this pound of beef at 4 p.m., I'd lose the same amount of weight if I wasn't intermittent fasting and I ate this pound of beef at 7 a.m. and this pound of beef at 10 p.m. The body doesn't lose weight extra fast depending on the time of day. And whether I eat both pounds of beef in one meal for the day, or if I split these 2 pounds up into 6 smaller meals throughout the day, same thing. At the end of the day, I still ate 2 pounds of beef.
Yeah, I have to agree with that. There might be some nuance that people quibble about, but no, that's right. To me, I teach it doesn't matter when you eat, it's what you eat. And then the language that you've heard is eat as much as you want. Well, on a low carb or keto diet, I say that. You can eat as much as you want because I know you won't want much. Just about everyone has a reduction in the amount they eat because they've become a fat burner and they're getting access to their fat stores that reduces the amount you need to eat for caloric needs because you're burning your body fat. But yeah, I don't think it matters when you eat. And the idea of intermittent fasting, the food that you eat when you eat is really important.
Technically, you could gain weight intermittent fasting if you ate more food in your condensed eating window than you typically eat in a day. Now, this is not very common. This doesn't happen very often, but regardless, fasting doesn't automatically equal weight loss. What matters more is, are you eating less food regardless of your eating window?
Yeah, this gets into the use of language, right? So that if you're intermittent fasting or you're following a Mediterranean diet or you're eating colorful foods, this is all qualitative sort of instruction. It doesn't tell you exactly what to do. And the research that I've seen done by a lot of very distinguished research groups have defined intermittent fasting as a carb-heavy meal once a day. And the results really aren't very impressive. So that the idea of cutting carbs, even if you're intermittent fasting, is important to me and in my teaching. If you want to reverse diabetes, lose weight, or other metabolic problems, cut the carbs down. If you're not hungry and you eat once a day and call that intermittent fasting, that's really the endorsement that I give, is it's okay to intermittent fast if you're doing it from within from a suppression or normalization of hunger.
So do I have to fast to see weight loss? My response is you don't have to fast to see weight loss. It's kind of personal preference at that point, but there's other benefits to fasting like mental clarity, longevity, and gut health. So let's talk about those and if it's worth it.
Yeah, so what you're seeing here is going from a qualitative, let's eat this, tell people to fast, all that, to a quantitative approach where you're using an app, you're calculating the calories and the proteins and carbs, I hope, and you keep the carbs low. And that theme that you hear about insulin spikes, that insulin spikes are reduced or eliminated if you cut the carbs out of the diet. So changing the meal is, to me, more important than the time of the meal. I totally agree.
Now let's talk about the other reason people fast, the health benefits beyond weight loss.
Cardiovascular benefits.
May prevent brain degeneration.
Decreases autoimmune disease.
Can stimulate autophagy.
Decrease inflammation, and in animal models, you even have increased longevity.
And one of my favorite benefits, less time in the kitchen. Less meals means less cooking and less cleaning. When I skipped breakfast, I also had more mental clarity. I was sharper, more focused, more productive, which makes sense because anytime we eat food, the blood from our brain has to go into our digestive tract to help with digestion. And so when people don't eat, they might feel they're more mentally sharp and clear. There's also autophagy, which is the body's process of clearing out old or damaged cells, which can help cellular health and has been linked to longevity. Also, for people who have more digestive issues, fasting can give the digestive tract a break, giving it more time to repair, heal, and reduce inflammation. So yes, there are a lot of benefits to fasting that have nothing to do with the scale.
Yeah, I have to agree that that's a good summary of the science so far. And a lot of it's preliminary work in animals, but the main idea that it's okay not to eat as much or so much, that seems kind of obvious, doesn't it? Except we've grown up in a world where we've had food and we've been taught to eat food all day long, and it seems weird then to be able to not eat as much and to be healthier. But I think it's an important point that if we were taught you have to have breakfast and yet you feel better without breakfast, that's just fine. One shading of the information here that I'd like to give is that if you're in nutritional ketosis, meaning you're not eating carbs at all, really, doesn't matter when, you're probably getting a lot of these benefits of autophagy and other fasting, or the idea that you're not eating anything. It's called fasting, but when you're not eating carbs, you're in nutritional ketosis, which is really the metabolism of fasting. So you're getting the health benefits, or most of the health benefits of fasting, and you're eating at the same time. Years ago at a meeting, when I first learned about low carb and keto diets, the doctors from the 1960s and 70s who were doing the research at that time called a low carb keto diet fed fasting, meaning you get the metabolism of fasting, but you're also eating at the same time. So I'm excited to see studies now looking at nutritional ketosis and the effects, comparing that to total fasting, and the effects are similar, if not the same. So you can be eating and getting the results of fasting, just don't eat the carbs. That's the approach that I teach.
But sometimes these benefits aren't worth it and fasting can backfire. At least in my experience, when I was trying to eat all of my food in a short eating window, I couldn't eat enough, and therefore I was under eating. I was eating 2 meals in a day. I was eating 1 meal at 11 a.m., 1 at 5 p.m., and I felt satisfied, I felt full, but the reality was I was unintentionally eating around 1,200 calories a day. At first, I leaned out, but like I mentioned, eventually I started losing more hair, more muscle mass, my menstrual cycle became irregular, my hormones out of balance, I was feeling cold all the time, I was tired, and my body started slowing down.
So if you're not feeling well, please talk to someone about it And so I'm glad when she wasn't feeling well, she started to rethink it. I'm curious, would have liked to have known, and maybe we'll learn in other videos, how much exercise Lily's doing. To support exercise, you need to eat more. And also to support menstrual cycles and overall hormonal health, you need to have a certain amount of body fat for a female to be able to menstruate. If you think of the extreme of the marathon runners or women with anorexia, they don't have normal menstruation. So if you're a high-level exerciser, you're in the gym all the time, you're going to want to pay attention to the amount of food. Now, most of my patients are not in the gym multiple days a week. They're, if anything, even struggling to get out of the chair because of knee pain. So again, this is one of the major contextual differences, is that if you're asking your body to be fit and you're at the gym, you want to exercise, then you need to eat as much as your body needs. But that's a different context, so that if you're not able to exercise, this probably won't be an issue of under-eating.
Just like a car needs gasoline, our bodies need food to fuel ourselves and to help us grow hair, to feel warm, to have lots of energy. And if there's not enough fuel coming in, then the body starts cutting corners and shutting down. That's what happened to me and so many of my clients, men and female, who have been fasting for so long, for so many years, they've been under eating, that now they're dealing with the aftermath of hormonal imbalances, low testosterone, insomnia, hair loss, adrenal fatigue, thyroid issues. Fasting is a stressor. Just like exercise, some can be beneficial, but too much can backfire. Yes, I have seen people completely transform their health fasting, but I've also seen people spiral with it.
So I'm curious here to see or know if these were people that have been doing low carb diets and eating less. That's a different situation than if you're eating carbs and you're intentionally fasting and eating less. It's a different metabolism. And I would like to see research in this area. There's a pretty strong clinical signal of how to change the food, and I think there are probably many different ways to do it. If you're not feeling well, you are following any really dietary approach, talk to someone, an advisor, even online nutritionists, I think, are fine for advice within the non-clinical realm. I mean, if you're on medication, you're reversing diabetes, obesity, other metabolic syndrome, follow with a doctor who knows those medications and how to get you off safely.
For example, some people might think that if 12 hours of fasting is great, then 18 must be even better, then 24 must be even healthier, then 48 must be even more healing. They end up overdoing it, and now their health tanks. So this is where fasting can be really, really great if the body is still receiving proper nutrition. I know there's people like Dr. Sean Baker and Steak and Butter Gal. They eat 1 or 2 meals in a day and they're thriving. They have great hormones, good energy, they feel amazing, but they also eat a ton of food when they sit down to eat their 1 or 2 meals. So I'd ask myself, are you someone who's able to do that? Because for me, I really did try to eat all of my food in just 2 meals, and it was too much. I felt stuffed, bloated, I just didn't feel very good. So now I eat 3 medium-sized meals in a day. I feel like this is a bad representation. You guys have seen my meals. They're still pretty large, but it's easier on my digestion. I feel better eating the 3 medium-sized meals versus 2 very large meals. So yes, there are benefits to fasting, but I just can't eat enough food in a fasted window. Therefore, while I might get a little bit of benefits, I experience all these other negatives.
I was interviewed recently on a podcast of someone who's been in the keto primary. I was interviewed recently by someone who was walking on his treadmill while he was doing the interview. Ben Greenfield has been in the paleo primal space for, he mentioned, since 2008. And he exercises so much, he was exercising while he was doing the video on his treadmill. So he told me as an aside, and it may have gotten into the video, that he eats a lot of carbs, but he's still keto because he's exercising all the time. I have to imagine that's what's going on with Lily, and that she's exercising. That's a big part of her life. She wants to maintain that. And so you're going to have to eat up to the exercise that you do. That's not the case in my clinic. If you're one of my patients, don't feel like you have to keep eating more and more. And it's a personalized thing, as she's saying. And I don't know why she didn't talk about exercise as the primary factor here. That's coming through to me.
So to me, it's not worth it. I get it. A lot of people are turning to fasting for weight loss. And if you are trying to lose weight, you do need to be in a deficit, but that doesn't mean you have to fast. And it definitely doesn't mean you have to cut your calories in half. Let's say someone is currently eating 2,500 calories in a day and they cut it down to 2,100. Well, they'll likely see weight loss whether or not they eat that in a short window or over the course of the day. Either way, they're still in a deficit. Or I know some people who they would rather, instead of cutting it down to 2,100 7 days of the week, they'd rather continue to eat 2,500 calories for 6 days of the week and fast 1 day of the week. Either way, they're still reducing their weekly intake. It's kind of personal preference at that point. The real problem is when people are trying to lose weight, they slash their calories in half. Now they're eating 1,200 calories a day, and they do this for months, even years. I work with so many clients who they've been under eating for such a long time. Their metabolism has slowed down. They're not even seeing weight loss at 1,200 calories. That at that point, the only way to see more quick weight loss is to eat even less, thereby having less protein, less vitamins, fewer minerals, less nutrition as a whole. That's not sustainable, and sometimes this doesn't even lead to more weight loss.
Well, and so now we're getting into the dietitian, nutrition teaching, and now the medical weight loss. So this is a big contextual point. The approach we use in the medical world, some surgical weight loss, takes the calories down to zero. So if someone comes to a weight loss surgeon, they make the stomach about this big as a hen's egg. I was corrected once. I said it's as big as an egg because the surgeon who listened to me said as big as a hen's egg. And if you've ever had an ostrich, apparently their eggs are a lot bigger. So it's a hen's egg. So the idea that you can't go below, you don't want to do that without medical supervision. Someone trained in obesity medicine like I am can use pills and shots, and the surgeons, weight loss surgeons, use a technique that basically gets you to eat almost nothing. So yes, sometimes there are situations where you want to go below that limit.
So what I do with clients in this situation is we do what's called a reverse diet, where we slowly increase their food intake, boost their metabolism, get their body able to handle more fuel. Then once they've been in that maintenance mode, we can cut down a little, and boom, they see weight loss at a higher intake than they were doing previously, with more energy, better hormones, and better sleep.
So reverse dieting, I've heard of this. I haven't seen any study about it. So why is a study important? A study will outline exactly the method that you're doing. Now, some argue that a study with that sort of methodology is limiting because you don't customize it based on the individual. Well, so I'd like to see some research on reverse dieting. There's certainly a clinical signal about it. If you're one of my patients, though, and you hear, oh, well, I have to eat more to lose weight, this is nonsensical. But in the specific condition of if you're exercising, you're feeling low energy, and you can do a reverse diet with supervision, I think that's worth trying, although the science isn't there to support it in clinical trials. That's an area where I would like to see research if I had all the time and money in the world. Let's take people and follow two different methods. They continue the caloric restriction or the ad lib low carb, or you don't explicitly say restrict calories, or reverse diet and see if you can increase the metabolic rate. I think that's interesting, and one-on-one it may work. I don't know any research yet to support that, though. But in general, I like the idea of getting help with a trained professional if what you're doing isn't working. I mean, we go through training to do what we do. If you had a job, you would be trained in order to do it. So reach out for help from someone if what you're doing isn't leading to the results you want.
Don't be silly, subscribe to Lily, and I'll see you soon.
The latest diet.
So intermittent fasting it suffers from an ambiguity of what the definition is, because what people eat when they do eat is not well defined in the world of intermittent fasting. I think it's a useful tool. I teach an approach where people eat less and have less hunger and intermittent fast on their own, and kind of say they're intermittent fasting when they're not hungry. And that's what I'm really trying to achieve, is the reduction or elimination of the urge to eat. It's liberating for so many different people. Thanks to Lily for another great video. And of all the influencers I see, I like and I value people who are in a kind of program where they're getting experience from other people. And that can even happen on the comments and in questions below. Be sure to put your comments and questions below so I can answer them as we go forward, and let me know what you think about that approach. I hope you like this. If you do, be sure to like, subscribe, ring the notification bell, and look out for new content on Wednesdays and Fridays. If you enjoyed this video, consider joining our YouTube membership for early access and exclusive live Q&As with me. Just click the join button below or support us with a PayPal in the description.